the world of medicine and law, there's a big debate about how we interpret what we see in medical images to the cause of an injury. Imagine someone has a serious accident and needs an MRI to check for any issues. Determining if the injury shown on the MRI is directly connected to the accident is what is called causality. Back in 2001, a study by Fardon and Milette tried to standardize the names for different kinds of problems with the spinal discs that appear in MRIs. They listed all sorts of disc issues and how they look on the scans, but here's the thing. Doctors mainly care about how things look, not how they got that way. In the legal side of medicine, there's really only one thing that matters: if the disc problem is because of the accident or if it was already there before. So the focus for them is really how the disc looks on the MRI instead of how it got that way. When we're trying to figure out what caused the disc problem, we need to understand how the disc reacts to different kinds of forces. For example, what happens when there's a sudden burst of energy through the disc, like in a car crash, and what happens when the disc gets small bits of force over a long period of time, like in a degenerative disc. The important thing we're looking for is a tear in the disc's outer layer called the annulus fibrosus. We can see this tear on an MRI or a special test called a discogram. We can also make a diagnosis frequently based on how the disc behaves if it's torn. Any kind of tear can change the shape of the disc. There are two main types of tears: radial tears and circumferential tears. Radial tears happen when there's a sudden burst of energy through the disc, like in an accident. This can cause a disc herniation where the inner part of the disc pushes out. Circumferential tears happen when the disc is under continuous force over time, like in degeneration. This can cause a disc bulge where the disc protrudes outward. A study by Causality and Milette in 1997 showed that radial tears are not related to degenerative changes in the disc. This means that if your MRI shows a circumferential tear instead of a radial tear, we have to look deeper causes coming from lifestyle versus an accident. No matter the cause, we want to make sure the treatment addresses all aspects of healing properly. So when treating your condition, we need to consider factors like your lifestyle, diet, exercise, and nutrition that might be influencing your disc health. This is a key part of functional medicine, which is becoming more common in medical practice. To treat patients who have been in accidents or have injuries, we need to look beyond just the immediate problem, especially if there's evidence of a circumferential tear on their MRI, to solve all the potential issues that may prevent the injury from healing. Seeking appropriate medical attention is crucial for individuals who have been in an accident, are experiencing ongoing pain, or dealing with chronic inflammation. Our team at the Center for Integrative Care is dedicated to providing support and guidance on your road to recovery. Don't hesitate to reach out to us at 619-287-4005 to learn more about how we can help you regain your health and well-being. Our practice serves the San Diego, California area.